Good afternoon. Hopefully, it's a safe travel for everybody to get on your screens today. I'm with some esteemed colleagues here for our very first LinkedIn Live session. I'm John Barnacle-Bowd. I'm the Vice President for Environment, Health and Safety at RS Group. And what we're going to do today is look at some of the current issues facing health and safety professionals and digging into the Under the Surface Health and Safety report that RS Group created in association with the Health and Safety Matters magazine earlier on in the year. That is downloadable. I'm led to believe there's a link available in the chat. I'm now going to introduce you to the panelists. If I can start with you, James.
Yeah, sure. Hi, everyone. My name's James McPherson, Director of Riskfluent Consulting and Risk Assessor app, I suppose.
Hi, I'm Bethany Holroyd and I'm a Health and Safety Business Partner for WSP in the UK.
Hi, I'm Louise Hosking and I'm Executive Director of Environmental Health at the Chartered Institute of Environmental Health.
Thank you very much. Now we have a few questions for this afternoon, and we have had some questions already posed to us by some of the attendees. First of all, though, I just want to go through some statistics from the Health and Safety Matters report that we actually created. So the gender for those that responded to that were 74% male, 22% female, 29% of those were health and safety officers, and 33% came through as others. So that could be any of us, I suppose. Industry-wise, the highest number of respondees came from the construction sector, with 17%, and the lowest was from education. We did have a category with others in, and that came at 38%, and they came from communications, aerospace, rail, and other such industries. So I think there's lots more scope there for other categories. 722 respondents from UK and Ireland, and as I said already, it was created in partnership with the Health and Safety Matters magazine. So the discussion points this afternoon, we're going to talk about sustainability in ESG, budgets, which is always a challenge for us, skill shortages, mental well-being and compliance. And if we have time at the end, we'll have some of the questions that have already been posed to us. I'm going to mix it up a little bit. I'm not going to go to sustainability and ESG first. I'm going to go to budgets first. So budget cuts and pressure to improve productivity was seen as a risk factor in health and safety by 45% and 43% respectively. Budget cuts are felt to be a serious risk by decision makers in public services and health and social care at a rate of 4 or 5. So questions for the team here. Where are you most feeling the pinch points at the moment with budgets? James?
I'll probably come at it from quite a different perspective because we're running businesses that are essentially trying to take out of those budgets. I suppose we see it quite differently. I think the way that I would look at it is that we need to appreciate what that company kind of values and where they're trying to go with it. I suppose it's hard. I kind of struggle with the whole, like, watch the news and everyone's like, oh, it's a real terrible economic position. And because a lot of the businesses we work with, they're all busy. They're all like just, some of them throwing money left, right and centre. Some of them are a bit more tactical and strategic on it, 100%. But I don't know, I just struggle what that looks like in reality. But ultimately, I find that it really comes down to what the business values. If the business is like in this concept or project or situation, safety, for example, which is essentially what we're selling, is what they want to spend money on, the budget kind of becomes less of the conversation. So I think it forces, in a way, safety professionals to look a bit more broadly and stop thinking like health and safety first. No, a business is trying to balance all of these things, and sometimes safety takes the hit and then sometimes it doesn't. So I think it forces us to celebrate when it doesn't as well. That's a slightly different perspective, but hopefully.
Okay, yeah, that's fine. Louise, do you have a...
Yeah, I've not been in this, or I sort of say I haven't been in this role very long. It's just coming up to 6 months, and we're in budget time at the moment. So I'm setting budgets for my directorate at the moment, and it kind of makes you really focus in on where the money's going, where organisations spend, how they spend, and so on. And for me, you know, great points. I think it's all about priorities as well, because business leaders have a lot going on in their heads. They have a lot of conflicting priorities, and it's working through, actually, there's loads of stuff that we can do in terms of health and safety, but what are our key priorities? How can we be really strategic? Quite often, if you're clever, you're creative, if you've got that kind of culture within your organisation where people feel able to contribute, you can be really creative, and it's about looking at those top tier issues and funding top tier issues that actually filter all the way through the organisation. I think the whole issue around finance, you know, I could probably talk about that for this entire session. But one of the areas that we're advocating at the moment is that, you know, we shouldn't be having a health versus wealth debate. If we can focus on how we resource good health priorities, actually we're going to create a workforce that's productive, that is able to solve some of the really difficult challenges that we've got going on in the world at the moment. And when you look at some of the top spends that the NHS is spending money on, actually, you know, you start to pull out the broader, you know, UK PLC. If we can prevent health at source, then we're going to save money along the way. And it's just getting that message across. But exactly as you've said, understanding that businesses are a massive ecosystem and it's not all about us.
A big part of that as well, I think, is being open about it. So a lot of the time, if we're in a sales conversation with a customer, I will say, what's your budget? And they always get a bit nervous about it because they think I'm trying to play a game with them. They think, like, if they say, oh, it's this, I'm gonna like go a bit over that and play a game. No, I want to know how much I can give you for that budget. And I will just honestly be like, this is what I can give you. So maybe being a bit more honest and open about our budgets as well would be a lot more beneficial.
I hear a lot of organisations talk, we don't have a budget for health and safety.
Yeah.
Because we pay for it, but sometimes that's a bit of a detractor for us, isn't it? Because we don't know what we can go for. Can we have something new? Can we have a new piece of tooling? Will that take precedence over the health and safety requirements? So
I think it's about us being involved in budget setting. So I'm not sure how many professionals are actually involved in supporting their organisations and businesses to budget set. And perhaps if you know, it's not something that necessarily comes naturally. You know, I've run businesses and you have to know your numbers. And actually, if we're part of that process of setting budgets, that's also going to enable us to plan forward, and having a really good strategic plan is what it's all about as well.
Agreed. Good. I'm still not staying on script, but our next one is going to be on next question on employee compliance. The majority, 72%, believes that compliance of their company employees with health and safety equipment, policies and procedures has improved post-COVID. And I think COVID did health and safety professionals a lot of help, I think, to put us at a level playing field. Workplace culture is seen as the most impactful on employee health and safety compliance, followed closely by training and development. Although it would seem a potential very important aspect, workforce churn is perceived to have at least an impact on employee health and safety compliance. So, questions. I'm going to pose this to you, Beth, because you've been quiet so far. Is post-pandemic, are there any other barriers to compliance you're facing, and how are you tackling these?
I think.
And there's a sub-question.
Okay.
Does health and safety need a rebrand?
So I think what Louise was saying there around business focus really plays into that, because, you know, one of the things that I say and I hear other people say is that health and safety shouldn't be a priority to a business. It's a core function, it's a value of a business, and that forms part of that company culture. And I think that within the space that we operate, I do in with the additional question, I do think that safety does need to be rebranded. I know that we were actually talking about this earlier in the way that the industry is perceived, in that it's often viewed in quite a negative light. You know, it's this has gone wrong, this isn't right, compliance is down, training's not good enough, we've had this many incidents, and I think that for me, if we could flip that on its head and we start looking more at the leading indicators and we look at it in a more positive light, I think that, you know, one of the things that I'm really passionate is psychological safety and building trust within the teams that you support. All of the, I think probably the kind of fluffier things that it might be badged up as, in the long term, the compliance will help it itself. If we focus so much on compliance, let's get the instant gratification. Training needs to be up, compliance needs to be up, incident reports need to be up. It's not sustainable. You're not building that, you know, that culture that you want. And I mean, there's arguments as to whether safety culture exists by itself anyway, which we won't get onto. But I think that when we look at an organisation's culture and the behaviours of the teams that you work with to get the compliance, considering all of the other focuses of the business, the finance and everything else that needs to be considered, I think we need to be more understanding of the people that we're looking after. You know, at the end of the day, we haven't got a business unless we've got those people there doing and delivering that work, and we need to put trust in them. We've employed them because they're competent professionals. We need to trust them to be able to do their work well. And, you know, they've got that level of expertise. The compliance within your internal business is what that business wants. And so we need to work with each other because we don't want to impact operational delivery, but equally we want to make sure that our staff have got the right skills, knowledge and experience to do what we've asked them to do in the first place. So I think I probably not quite answered the question. I do think we do need to rebrand safety, but I do think we need to be more considerate and trusting of the staff to get that compliance in the long run.
All right, thank you. James, have you got anything to add from your perspective? You sit there slightly different.
Yeah, we run a podcast and YouTube channel called Rebranding Safety, so I think my answer is kind of obvious. I suppose there's obviously there clearly is two questions in there, but I find them slightly different. I think the brand of safety is very important. I think we do approach that quite naively, or maybe just separated from reality. I think that policing brand is still there, and I think it's there at all levels, particularly in construction. You only have to spend 2 minutes on TikTok to see that it's still there. The way that people talk about our profession, the fact that we're asking, do we need a rebrand, to me just feels like we're just in a little cloud. Like, can you imagine if no other brand ever evolved through the years? Like if Nike still marketed and branded themselves the same as they did when they first started, they just wouldn't work. Every brand evolves, so why don't we? It feels frustrating that we still haven't had this conversation, but more that I don't mind having the conversation. I suppose more that it's challenged and that people go, oh, we don't need to rebrand. And then the compliance bit, I would say, like, behaviours is a complicated space in its own right, but I think if we think about backing off of what you said as well, like if we think about the framework that we put in the workplace of procedures and stuff, which maybe we call compliance, it's about giving them freedom within that framework. And I think one of the questions is about competence and skills that we'll come on to, but that's a massive part of it there as well. But yeah, you are right, we're employing people and then we just turn them into robots as well and just say, oh, follow the rules. And Daniel Pink's book, Drive, is phenomenal on like what actually drives humans to make certain decisions. And it's not carrot and stick, and money is not one of the main drivers. It's like purpose and stuff like that actually helps.
Okay, good. And I think this is different for all businesses as well, isn't it? And Beth, you picked up a word there, culture, linked with values. I think, you know, a lot of people talk about safety culture. Yeah. And it's always good to have a positive safety culture, but what a positive safety culture looks like in construction may well be different to what it looks like in my business, or, you know, even with what you do, James, with some of your clients. So I think it's different everywhere that we go. Okay, so jumping back slightly, sustainability and ESG. I think we've all getting challenged at the moment to extend our remits. I know, Beth, you and I were talking about are there roles where you just do health and safety now? We seem to have a bit of quality, a bit of environment, sustainability, ESG, security as well came up. So there's lots of bits that are going into that traditional health and safety role. So just some stats from the report itself. 39% of respondents are concerned about climate change as a long-term impact on health and safety. I think climate change is a long-term impact on the planet, let alone just health and safety. This statistic runs parallel to the rise of additional remits, including sustainability, 27% of respondents, and ESG, 15%, amongst health and safety decision makers. Ethical PPE sourcing is more important to Irish health and safety professionals, interestingly. And 28% of survey respondents in Ireland make it a priority in comparison to 23% in the UK. Interesting facts. So, key questions. I'm going to come to you first, Louise, on this one. How are you balancing sustainability requirements with cost savings?
Yeah, I mean, my new role is kind of blowing this all out the water now. So, I've been talking about how sustainability fits into health and safety for a long time. But the role that I have now at the Chartered Institute of Environmental Health, we are putting in a capital S into the social part of ESG and social sustainability. So environmental health I think is one of those areas that everybody used to perhaps know something about, and less so now. So we look at environmental protection, we look at public health, we look at food safety, we look at health and safety, and we look at housing. And there's a huge intersectionality around that. And all of those different areas kind of pull on each other. So when I talk now about sustainability and the impacts that exist, they all cross each other. So an organisation will obviously have environmental impacts that evolve from that organisation. But now I'm challenging us to actually think beyond that. And if you run an organisation or you have a business, what's the impact that business puts on the environment and the community around it? And that can be either positive or negative. And that does start to probe us and to say, actually, health and safety has evolved and our roles do evolve. They move. We don't set the agenda. Business and what goes on outside of our sector sets our agenda. And we're really good at managing risk and looking at complex problems and finding a way through those. And I'm fascinated by what our membership is already doing in this field, and being able to now talk about it in a much broader sphere. We're going to bring real value to organisations, but more importantly, we're in a climate emergency now, and the way that we do business has got to change. We've got to have a much more integrated approach to nature, to people, to economics, and we've got to move on. We've got to do things differently, because if we don't, climate change is, we're at a point where we need to be bold and we need to step in and deal with this. And actually, I think our transferable skills are well placed to do that. I think the people that I work with now, the membership I work with now, they've been doing it for a long time. So it's great for me to be able to talk about that much broader aspect and say, we can do this if we're strategic, if we're business minded, if we have a leadership mind. We are coming from a leadership perspective rather than management perspective, and we take people with us.
Okay, good. I think when I look at it from the RS perspective, if I go back 5 years ago, we probably spoke a lot about environmental compliance. And if we had environment, health and safety people, we probably had the environment piece because you're a safety guy, and it was a compliance piece that was stuck into that. 5 years ago, ESG sustainability was probably in its infancies in, many of the businesses we've got out there. But it's how we have morphed from having that environmental compliance piece to the bigger piece now of ESG when we're looking at, the whole scope of environmental, all the legislation, science-based targets, TCFD, all the other letters and words you can use, because it's probably worse than health and safety for a lot of the little nicknames that we've got.
And don't forget the G. So the governance part.
Exactly.
So actually, by learning about governance is really important to organisations now because of reputational risk. So actually learning about governance and learning how governance operates within an organisation will enable professionals to actually understand the broader aspects of business risk as well and where they fit in. So learning about governance makes us more effective as well.
Well, the consistent narrative or the consistent word you're using there is risk. And that's how we would talk about it with our customers. So we have like a bit of a framework that we work, which is about operational risk. So that's how we would talk about it. The technical aspects of environment, or whether this new or that new or whatever, that needs a specialist. But risk management really is the same. So I think maybe I think we're going to come on to skills again, but like ultimately maybe focusing a little bit more on understanding risk management as a skill is something that would help us there as well.
I myself, I work in our ESG team, and because I have the E, I have the health and safety, but I think as we go wider, is to understand we do sit in that social piece and the governance piece, as you said, Louise. So I think it's going to come more and more. So, but segue into skill shortages, James. So some facts from the report: 51% were concerned about skill shortages within their companies, and 45% of people were concerned by budget cuts in their organisation, going back to our first point. Respondents in public services and healthcare were most concerned when it comes to skill shortages in the future, that was 63%. And this is compounded by 68% also identifying budget cuts as a serious risk, compared to a sample average of 45%.
Wow.
So the question, probably start with you, James.
Okay.
No, I'll start with Beth. I'll stop.
I've had enough.
What do you believe can or should be done to combat skill shortages, and how are you plugging any gaps within your own organisation? That's why I've come to Beth first, because it's slightly...
No, yeah, crack on.
I could talk all day about this. So I think within our organisation, WSP have got, we employ apprentices and we've got graduate programmes, and, we have really attractive roles for encouraging young professionals into the industry from an engineering point of view. And, we do cover other roles beyond engineering, but we are engineering consultancy. I think kind of taking a step back with taking my WSP hat off and looking at health and safety and the landscape of health and safety, I think that I've recognised certainly after I moved out of an operational role within civil engineering and into health and safety, that there's not a great deal there when it comes to promoting health and safety. And, health and safety spans every single industry that you can possibly think of. We aren't just existing in the construction industry. We're in manufacturing, within, kind of retail and banking and, working with education. We cover absolutely everything. And, I sort of recognised this when I started out and thought, I'd done a lot of work over the last 10 years of my construction career, going out to schools and, kind of flying the flag for the construction industry. And I went to an all-girls school as well, so it was something that wasn't promoted to me. And I thought, what, I'm whinging about it, but what am I going to do about it? I don't want to just kind of pay lip service and just sort of say, well, recognise the skill shortage. I was saying earlier that I read an article this morning that was saying we need over 930,000 people by 2032 within that's just the construction industry. I mean, we are, and I'll talk from the construction industry, we're knackered. Like, we need to do something differently, because we're going to get to a point where, looking at the demographic from the report, back to health and safety, we were saying earlier that I think around 50% of the people are older men within the industry. What are we doing to change how, we talked about rebranding safety, what are we doing to change that? And we spoke on the call, and my own personal kind of drive and passion projects that I've got going at the minute is I have written a children's book about health and safety. And I know that we spoke about this at a conference recently, because, I've got a little boy who's 6, and he thinks, putting his helmet on and learning to cross the road safely, and he helps his school with risk assessments and keeping safe. He thinks it's the most interesting thing ever, and it's I speak to adults within the industry who hate the fact that I've turned up to a meeting because, oh God, health and safety is here kind of thing. What happened in between that? Why has our opinion changed? My son thinks it's really interesting because he gets to kind of tick boxes and kind of make sure people are safe kind of thing. But then we've got adults that, when we look back at compliance, that find it really difficult. And is it because of the pressures? Is it because it's not a kind of a sexy, attractive industry? What is it that changed between, being a young child and an adult within the industry? And so I've written a book around how we make sure people go home safe at the end of the day. It's written from the point of view of a young child, and it's kind of looking at how we look after each other and how we're kind to each other, and kind of really explaining it in a way that would be attractive to someone who's at primary school level. And within all of the work that I've done to look at STEM and the promotion of the industry, and I've said this before, we're targeting students too late. We're going to schools and high schools and colleges. They've already decided that they don't like maths, or they don't like science, or that they don't really want to do PE anymore because it's boring to them. We need to go back further. Children, young children, and I know this from my little boy. He thinks that there are so many things that are interesting to him that I think as an adult, God, why do you find that interesting? This is boring or it's awful. And we should be channeling that energy into, kind of encouraging them to use the inquisitive nature that they have to be curious. And I know that you guys at Riskfluent talk about being curious and, kind of encouraging people to look at things differently. Children are perfect at that. And so for me, it's very much that we need to try and encourage much younger people into the industry.
Focus the industry young.
Yeah, definitely.
Very conscious about times, James. Have you
Yeah.
got anything to add on that one?
I would just say I think you're hitting the nail on the head on with getting children to buy into stuff. We're actually doing a really cool project with a trust of schools at the moment where we're getting the teachers, and they have to do risk assessments, go on field trips. They're a really forward-thinking school, and we've been kind of laughed out the room a few times when we've said about doing something like this. And we said, do you involve the children in the risk assessment? And this, like, everyone was like, no. This school, we were like, these guys are a bit forward-thinking, maybe we should try this. So we pitched it to them, and they were like, love it. So we're actually working with them now to try and do exactly what you're saying.
Like though, innit?
Yeah, exactly.
Kids want to copy the adult. Like my little boy thinks it's amazing that I've wore a high vis vest and that I've gone on construction sites and that I get to work with big trucks, and now that I work in health and safety, he wants to copy that, and he wants to keep his classmates safe, and and I think we kind of talk about the industry being a bit tick box, but that's something that helps them understand, particularly at that age. It's something that's could be interesting to them. And it is, I think that's
the only last thing I was added, when we talk about competence as well, when we're consulting, we would talk about not just task competence, which we're quite good at, but also like risk competence, so how people thinking about risk and how people make those risk-based decisions, and also social competence as well, how we know how to talk to each other, engage, inspire, have difficult conversations, psychological safety, as you mentioned earlier. So it's not just like, do you know what that drill does here, for example?
Maybe we do need to rerun health and safety.
Anything to add? I'm just gonna. This is a major issue in environmental health at the moment. So, the majority of our members actually work as co-regulators with the HSE, so they're regulating local authority environmental health. And I actually took a call last week with a group of health and safety enforcement officers who were saying that their number one issue was that they just don't have the boots on the ground to regulate. And actually, when something significant happens, and somebody on the call was talking about they'd had a major Legionella outbreak within their local authority that they need to deal with, and they don't have the resources to deal with it. And so that kind of brings a whole different dimension on it, because we need to be good at regulating. There are some people that need to be prosecuted, let's face it. I was really shocked by some of the things they were telling us on that call. So we do have a global skills crisis. That I think it's really important for organisations to see their health and safety teams and their environmental health professionals in exactly the same way as they would promote and they would develop individuals. And I think sometimes we kind of get left out of that. And so it's exactly as you've said, you know, the big organisations have got this really sorted. You know, they've got great graduate recruitment schemes. When people come out of university, they're not job ready. They've got to go through that process. And I think, you know, we all have a job to do. I'm fascinated by what our members do absolutely every single day. And, you know, so this is a plug to, you know, think about environmental health, guys. Yeah, it's an issue and we all need to work together on it because there is a global skills crisis. We're competing for talent and we've got to see it like that. And we've got, you know, so it comes back to the rebranding, I guess.
It comes back to the budgets though as well, doesn't it? Because not having resources is costing the
And
industry.
local authorities don't have the resources
No.
to put these kind of, you know, they are, you know, they're in not a good place.
No, yeah.
And the work that those regulators do is really important, and they need to. They also need to have those skills when something bad happens to be able to deal with it. Otherwise, you know,
When I was at the trade association, we had a primary authority partnership with a local authority, and environmental health was a big part of that as well. And they were so helpful. Like during COVID, they were an absolute game changer for us.
People.
So yeah, when you can get them, 100%. Yeah, I agree.
That was a report identifies that 59% are people of my age. May look like me and may be
Young,
like me.
really young.
Yeah. But it's what happens when those guys retire.
Yeah,
It's back to them,
and
that's
you're losing all that knowledge as well. Like, who are they able to pass that knowledge that they've built up onto? Because, you know, and that's the same with trades within the construction industry. You know, for a long time, apprenticeships were looked at as, oh, well, this is less than university. The people who do apprenticeships are the people who possibly couldn't have gone into an academic career, and it was viewed in a really negative light. And when I got my apprenticeship back in 2011, it was the first year that the Institution of Civil Engineers had been involved in developing a civil engineering apprenticeship, and there's this huge song and dance about it. You know, the president at the time was launching these apprenticeships and they were going to be amazing for the industry, and they absolutely were. In my cohort, I was the only girl and there was 20 of us that whole year. Now, Leeds College Building, the college I went to, Balfour Beatty, I think it was Balfour Beatty, it might be in Bamnutter, it's one of the tier 1 contractors. Their cohort for their company was, I think, around 60 people, and that was just for their company. And so obviously apprenticeships have grown. There's a lot of investment in apprenticeships. There's the apprenticeship levy as well, which obviously has really benefited the industry. But I think, you know, we have things like degree apprenticeships. We don't, and that's all within engineering, but we don't seem to have that same drive within health and safety as a you know, and there's environmental health, there's
We've got
fire,
great
all of these
as well.
We've got all of these really good, you know, opportunities. So I mean, we were talking about NEBOSH and NCRQ and all of the different MVQs and everything that you can do, but we don't seem to, you don't hear about it in the same way that you do with the kind of the STEM careers. And I think we all have a job to do to promote that.
And everybody out there listening today.
Absolutely, yeah.
So moving on, I think we're going to get on the naughty list in a minute because I think we've spent double the amount of time on that question. I know the next one is probably we're going to have to try and stem Beth from talking too much on this. Next one's about mental well-being. So this was part of the report, obviously, when it comes to companies' capabilities in delivering action on health and safety issues effectively, mental health stands out as an area of significant shortfall. And I'm not going to read all of these notes, but I think there's construction. They've done a lot on mental health over the last few years specifically, which is why I'm going to start with you, Beth. So, you know, we can talk about construction, mental health, well-being. It's about being confident or very confident in how we manage mental health and well-being. Construction was 61% of respondents were confident, so that's good. Going down as little as 34% again in education. So education was scored pretty low in some of these factors. So to you, Beth, first. I'm going to be strict on time, so I'll stop. What trends are you seeing in this area, and are there areas of concern or solutions?
I think we've probably touched on what my personal opinion is the issues are, is that because of the resourcing issues, and that's not just within health safety, that's within the wider industry, because we're not able to get the staff and everyone's competing with each other, everyone's under a lot more pressure than post-COVID, I would say. People have more demands placed on their time. We might not be travelling as more when we're looking at hybrid working, which I think has really helped a lot of people. We've got better work-life balance in that sense. But actually, people are not switching off in the same way that they were. Suddenly, they're having to focus the time more on, the demands of a client, for example, because actually, the team had people leave with the great resignation in COVID, and they've not been able to recruit to backfill those spaces. And so a team that was maybe 20 is now 10. You've got less travel time, but you've got more work time. And so actually, I think people are under so much pressure now. And adding the whole cost of living crisis to that, and people are tied in with jobs that offer that flexible work, and they maybe don't feel as confident to take the leap to go elsewhere. I think people are under a lot of pressure generally, ageing workforce and ageing families and everything else. I think we focus as an industry just on workplace well-being, but I think sometimes we need to take a step back and kind of look at it holistically and look at the pressures of life. And so I think that would be, kind of the trends that I'm sort of seeing, and just from the conversations that I'm having, and that's not just within my organisation, that's with other professionals that I talk to on a regular basis. I think we're all seeing that pressure and stress.
I felt really surprised on that statistic, if I'm honest. In construction, I was like, really? So it felt like there was an elephant in that statistic that we just didn't want to address, in that, what I'm going to pick a number out the air, but it must be like 80% of the construction industry is subcontracted. So they're like sole trader or small business. So actually, are they even included in the consideration of that conversation? Because most of those trades on a big house building site are like one person bands. So you're like, are they actually included in that? But it felt very far removed from reality, that statistic did for me.
For those individuals as well, this was a conversation that I was having the other week, and it's, for those people, they're working away from home, they're isolated, they're often staying in digs away from the families, and they're working on a project that might be 18 months, 2 years. And so, I know of friends in the industry who live up in the northeast who've been travelling down to Leeds or staying in digs in Leeds all week and then going back up home, or they've been doing the commute every day, sitting in a car for 3-4 hours at the end, starting end of your day, and potentially being isolated and not having friends around you. I think we really need to look at that holistic view, because actually they're coming to it maybe exhausted from travel, or their families are kind of getting on the neck a little bit because they're not seeing them, or by the time they get home they're too tired to do anything else. And I think
they get home, they have to do tax return, invoicing, all of that stuff.
We've also got as well, haven't we, how we care for those people. One-man bands is a really good point, because they don't have a support network in theory. We've done a lot of work having mental health first aiders in the business. So that's great. When you try and translate the mental health first aid training course globally, it may be, mental health is seen globally, but it's not really respected by that training course. So you can't really give that support perhaps as you would like to in some of the other markets globally. So that's how we sort of cater for our people there. How do we help them?
Yeah, I mean, just to pick up on some of those points, we're about, at the CIH, we're about to embark on we're going to start talking about mental health in a way that we perhaps haven't done within the CIH before. And we're doing exactly what you said. So because our members focus on health both in work and out of work and in their communities, we're really focusing on the part that they play to improve health and well-being. So if you think across the pillars, quite often the most vulnerable in society are living in really poor housing. They're probably not eating nutritious food. If they're really struggling, they're vegetables, potatoes, all those kind of things, they have to be boiled. We're in an energy crisis. So we're going to start to really unpick this whole issue of how mental health affects people from outside of work, so within the communities. And also we're looking at our members as well, because, you know, we've talked about the shortage of EHOs, you know, within the profession, and they're actually supporting some of the most vulnerable in society. So, you know, from a membership perspective, how, you know, we're looking at how can we support our members, because, you know, quite, you know, and it's the same for our industry. Sometimes you see some quite you see things that perhaps not everybody sees in their work life. And so it's really expanding that, because if we can get this right, psychological health and safety is within an organisation, it creates trust, which is exactly what you've said. And that's what creates great organisations, where people look after themselves and they look after the person that they're working next to.
But when we talk about, like you were talking about, you touched on demand on the officers there. So and when we talk about mental health, we always go like, oh, we've got like mental health first aid, but we're choosing not to address this horrendous toxic culture that we've got, or the fact that everyone's overworked. Like the HSE management standards have been out for donkey's years. They're amazing, and the amount of safety professionals that we say, have you read this? And they're like, what's that? I have no idea what it is.
It is to do with demands and priorities, and, you know, the opposite of complexity is not simplicity, it's reductionism. You know, we've got to look at what are the priorities within that business. You know, not everything has to be done right now. And again, within our profession, it can be really easy to make massive long lists of everything that you can see is wrong. But actually, it's about prioritising and creating a cadence that matches the ability of your people. So yeah.
I think just one thing to add to that, though, is we were talking about the focus on well-being, and, you know, the fact that that's maybe another letter for us all as health and safety professionals to look after. You know, for me, it falls under health anyway, the health of your staff. But I had a conversation last week around the health and safety team, and, you know, we see the incidents and observations as they come in as a corporate team, you know, and we, as you were saying, we see some stuff that's, you know, it's not particularly nice, and, you know, we're helping to support these people, and we have employee assistance programs, we've got wellbeing advisors, we've got wellbeing managers, they've got, but who's supporting the health and safety professionals? Where do they know that they can reach out for those same areas of support?
Good point. And the discussion doesn't stop there. If you've got any comments, put them in the chat afterwards. Now, we're very close to running out of time. We have AOB and Q&A. I'm not going to do any of that, but we have had some questions from the audience. And I'm going to do two, if you're very quick. So, James, first.
Yep.
One of the questions talked about AI.
Yep.
So, do you believe AI can be an asset to health and safety, or is it a threat? You've got 1 minute.
I would see it 100% as an asset. I think everything is a proportion of assets and threats, like everything is. The biggest threat from AI is probably how we choose to use AI. If we see it as a threat, it will probably become a threat. If we treat it as something that can help us, then I think it's a very good thing. But even if you look at, say, ChatGPT, and everyone's like, oh my God, people using that to write method statements or whatever. Well, yeah, because if that does the legwork, I can now do 3 of them, and my brain is actually focused on the quality of that and not the writing. So I see it 100% as an asset.
Excellent. Thank you. Okay. Question for Beth. Well, we get right close to the line. What sources do you recommend to stay up to date on health and safety issues?
So when I joined the health and safety industry in 2020, I remember that my predecessor had said to me, sign up to absolutely everything. And I did. And then I regretted it because I had about 1 million newsletters in my inbox. I was getting pestered to join up things. But I don't regret it now, because I can choose whether or not I follow up on those things. So look at newsletters. There are lots of great sources for newsletters. You know, you've obviously got IOSH. I'm a chartered member of IOSH. You can get lots of advice and help there. There's the HC website, there's legislation.gov if you need a bit of bedtime reading. Books, you know, I'm a keen reader, and it's, you know, for me, I've got a lot of the kind of the tools that I now use are from books that have been written by, you know, experts within the industry, and often those books contradict each other. And I think we need to allow ourselves to challenge our own perception and thinking. I know that we were talking about this earlier, you know, our view's not always right. We need to look at, differing views, because when we've got that diverse thinking, it allows us to progress. So books, newsletters, internet, and
you're missing one. This group.
So, and the group as well. Yeah, the group as well.
The primary function for this group is you can share learnings. Let's teach each other.
Yeah.
No health and safety professional knows everything
No.
in every industry. So let's share that. Let's learn from each other. So down to closing remarks, I think. Near enough bang on time, hopefully. So thank you for your participation. It's been really good. Thank you for those that are watching and those that will watch this later. I do think we're going to use this as some sound bites as well, so we'll have other bits out there. If you haven't done so already, please download that report. If you haven't done so already as well, please join this group, but I think you can only get onto this by being part of the group. So thank you for being part of the group. Share that with your colleagues, your friends. Let's make this group work for us. We haven't seen many questions in the group so far, but I think we should have more. Oh, we've got a couple.
We've got one answer one now.
Okay, one question then.
So Rob Andrews, having worked with certain local authorities, it has been said that they try to use health and safety as a stick to hit the contractors, including their health and safety people. That does not help buying in recruitment or the branding of the industry.
I think I'll go to Beth on that one first of all.
Yeah, so I support our local government business, and I used to work for a local authority as well, so I've seen it firsthand. And I think that, this goes back to that change in perceptions. A lot of local authorities don't have the resources for, that competent health and safety advice, and that's not to say that they don't have it. They do. Often, though, it's not focused on their delivery of construction and maintenance. It's usually focused inwards on the services they offer as a local authority, and so they buy in support from companies like WSP and other consultancies as well, and other contracts and organisations. It's very difficult though, because a lot of the individuals who maybe work within that local authority have worked there for a long time. They've seen everything, they've worked in that local area and they care about the local area. And, I know that when I've turned up to sites in the past and, as far as some of the guys there have seen, I'm straight out of uni kind of thing. Sometimes it can be a little bit of a challenge, but that is around perception. It's about understanding and listening, and I think as an industry we need to listen more to the people who know their job. We were talking about work as done versus work as imagined. We need to understand the work as done so that we can help support them, so that they can comply and so that they can deliver, so that we're in budgets and everything else. I think we need to do better listening. We need to kind of less of the bashing with a stick, and be more supportive and kind of caring as safety leaders to help them do their job.
Is that the job of the regulator though? The regulator is the stick.
I was going to say,
It's their job to be. It's our job to be the care for the people, understand work is done. The regulator might be able to do a better job if they understood work is done. I completely agree on that. But actually, it's their job to be the stick, and it's a good thing.
Yeah, and actually, this is a real quandary that I'm going through at the moment. So, obviously, our members are regulated.
Yeah.
Exactly as you've described, but some of the pressure these people are under are enormous.
Yeah, definitely.
And they are purely there to regulate. But that being said, they do go in situations where they've got to be sensitive. And so those kind of, that's part of the work that we're doing at the moment at the CIH, is to actually, start to introduce, well, what are leadership skills as opposed to management skills, and when to be flexible in terms of those skills, and also working with business and not seeing business as the enemy.
I think that's what we need to work on as an industry, though.
I'm working on that.
Working
Good luck.
the softer skills, because they are so. We've all done our diplomas, degrees, whatever. We know the law as within our respective industries, but we need to be good communicators, and part of communication is listening and understanding. And I spoke to one of my teams earlier in the year, and I said, is there anything that I can help you with that will make your job easier, that in turn makes your job safer. And one of the things that this team member had requested was a tool belt. They were doing bridge inspections, and it's really annoying because, you know, I'm trying to look at the bridge and I'm trying to write notes and everything else. I could do with a tool belt to hold my things, and I'm like, God, is that all it is? And actually, from having that conversation, that team has reached out to me lots of times, it's spoken, and that was it. That was just one thing.
So
Oh,
it's the people that are doing the job.
Yeah, 100%. Yeah.
Just to go back to the regulator issue as well, is that you know, we you know, WSP huge, you know, your
We're not
clients,
so huge,
your
but-
client, you're not so huge, but, you know, your clients can afford to, you know, use you as a consultant. Some of our members are actually meeting with businesses that will never ever meet a health and safety professional, and so they're working with micro organisations that would normally fall under the radar within local communities, and so, you know, they're doing this job completely under the radar. Nobody knows about it, and they're doing phenomenal work to keep the public and to keep those businesses safe and healthy.
Yeah.
Nice way to end. Okay. I think we'll end it there, guys. There are some other questions, and if you have other questions, put them in the chat, and we'll try
Maybe
our
we'll do
best.
an extra.
We'll try our best to answer them. This was our first session. I hope you've enjoyed it. I think it's been a great conversation. Me and Beth met face to face first time today, and we were talking for 2 hours before. So it's all good stuff. Thank you for your time. Please put your comments in the chat, and we'll speak to you again. Thank you very much.
Thank you.
Bye.